Too young for tox?
Let's talk about that. What is Baby Botox anyway?
Baby Botox, much like it sounds like babies injecting Botox or babies getting Botox injected, it ain't that. No, Baby Botox refers to the concept of getting Botox at a very early stage, right? Maybe even preventative before any wrinkles are there. We need to talk a little bit more about that.
I think there's a fine line between preventative and a little bit too soon.
So let's talk about static versus dynamic lines. And if you have some static lines, you may be candidate for Baby Botox. A dynamic line is a line that is only there when you move a muscle of your face. For instance, raise your eyebrows up really high, and there's some lines, relax, and they go away. A dynamic line occurs, but then when you put your muscle relaxed, it goes away. I think that that's not an indication to start Botox. However, if at rest those lines are there, they're a little bit etched in, I think it's very reasonable to start Botox because there's only one direction those lines are going, and that is deeper. In summary, if you have a line at rest, whether it's around the eyes here, whether it's here, in the 11s, then I think it's very reasonable to start Botox to relax the muscles because it can be done in a natural way. Yes, age is something we consider, but it's much more important no matter what age you are of whether the lines are there at rest or only when you move.
So why should someone do Botox at the first sign of these lines?
Because as we mature and those muscles keep moving and the skin gets less elastic, the lines are going to get deeper. So it's just a fact, right? So I think it's very reasonable for someone who has got a healthy emotional outlook on these things to be proactive if they want, because it doesn't take much Botox generally when you're younger. And I think it's very reasonable.
Who would not be a good candidate for Baby Botox, or why wouldn't you want to treat someone?
Here's a couple of reasons why you wouldn't want to do it. Number one, it costs some money, right? And so, as long as it's early, you have some time to wait, so it costs some money. There's always risk when you do anything in the face. First of all, there's minor short-term things like bruising. But if you were going to get Botox somewhere around here and it dripped into a certain muscle, the levator palpebrae superioris, you could get a droopy eyelid, which looks really weird for at least 2 or 3 months. Those are really the main things to consider, but none of those are permanent.
What about unrealistic expectations? Do you see patients who come in wanting Baby Botox, but their expectations aren't quite lined up with what we can do?
Yeah, I think that happens a lot when people think that we can really, really lift the brows with Botox. They say, I would ought to get some Botox to lift my brows. Botox can give a nice little kick in the tail sometimes for certain patients, and when manipulated a certain way, they can raise the brows a little bit, but it's not going to be like a surgical brow lift or anything like that. What are some of the other questions we hear about that?
Yeah, Baby Botox, especially people coming in for the first time, one of the big things that they want to know is, how often do I need to do this? If I start, do I have to keep it up?
In general, we tell most of our patients Botox lasts about 3 to 4 months. It tends to peak at about 4 to 6 weeks, and then it gradually loses its effect. In my, what we see in our experience is they're younger, they have really healthy skin. I would put a ballpark figure of more like every 6 months for Baby Botox for people who are really just starting. I think you have that leeway. It costs them less per year. So I would say 6 months. Do you have to keep it up? Well, the answer is no. If you don't, it costs money and stuff, and if you don't keep it up, you're not going to be behind the 8 ball. Nothing's going to be worse. Nothing's going to be, but you will start getting the lines again. Most people do keep it up. Will I become addicted to Botox?
Yes.
No, you don't.
Just kidding.
Addiction.
So when people come in asking for Baby Botox, they want to get started with this preventative treatment. What areas of the face are we looking at treating for them?
Yeah. Well, most commonly, it's where they first start to see lines is around the eyes and perhaps in the forehead and the 11s. Some people do have a lot of expression down here and have that, so it's possible, but I would not do anything proactively here if there are no lines and no issues down there. But I think if there are lines at rest here, very reasonable. So those are the areas of the face we typically start with right around here. You get a lot of questions about Baby Botox. It's a common thing on social media. I think that to summarize, number one, if you have absolutely no lines at rest, stay home. If you have lines at rest when you're not moving your muscles and it's something you want to be proactive, definitely come in, talk to a provider, find out about if it's right for you. I think it's very reasonable.
Talk to a professional. Sometimes Botox, baby Botox is the right answer, and sometimes a good skincare routine is. So find people that you trust and talk about it.
Especially if they're a ninja. Yeah. Highly encourage finding a ninja to talk to.
Yeah.